All right, y'all. Welcome into the next iteration of the Veteran Awareness Project. I'm just Cruz. Today, I think we need to talk about a couple of things that are, I would say a couple of things that it's like the elephant in the room kind of thing that's been going on lately with this whole we may lose benefits, we may not lose benefits, we may get cuts here, we may get cuts there. I think it's important for veterans to understand that there's nothing set in stone. I got a comment on one of my videos. Basically, the last recap when we touched on this thing a bit, and it was just like fear mongering. So it's interesting to say that when the thing is this is what's being publicized. This is the stuff that's being talked about. This is what veterans are being told. It's not a fear mongering thing. It's more of a hey, you need to be aware of the possible outcome that these things might happen. It's not necessarily saying that your compensation may be taken away, but the thing is the biggest thing that we have is healthcare. Um, they are talking about these situations. They are bringing it about. It's just like you have people that are being put in place that are part of Project 2025 that wrote these instances and put this information in there. And it's also the fact that it's just like you have to pay attention to that because the thing is it's not just going to go away. These are things that people have been trying to speak on, been trying to incorporate for years now. It's not something that is just like it just happens. So that's something that people need to realize when it comes to it, that it's just like these are things that may happen. These are things that may cause issues with us as veterans and just people in general, because there's a lot of changes that are going to come about. Thing is we don't know till they happen. The problem is that at that point when we find out when it happens, it's already late. We're already behind the ball. So the thing is that's making sure that hey, we start paying attention to what's being proposed, what the Senate is trying to say, what the House of Representatives is trying to do, what the Senate is trying to do. We got to make sure that we start paying attention to that, because the thing is it's those people that are in charge. Is those people that are writing these policies. It's those government officials that are writing this and what may cause changes to your benefits and other benefits in general. It's not only just for just veterans. The thing is it's veterans. We are in a very conflict arisen time. So it's kind of difficult to do that. But at the same time, you got to think about it like, hey, these are issues that are not only going to deal with veterans. This is just your family also. Because the thing is not everybody in the family is a veteran. Not everybody in the family deals with veteran situations. Not everybody has these issues. But the thing is most of these people need to see this and they need to hear it, because the thing is a lot of people get clouded in the information of what's being heard. A lot of people aren't being notified of like, hey, this is what's going on. This is what you're being told. This is what might happen. This is what might not happen. It's already been said that 119 billion not million, $119 billion may be cut from veterans' health. Now, the problem with that is that that's a third of the VA's budget. And most people don't realize that. And I posed that question to a couple of people, and I posed it on one of my videos on YouTube, basically, because I am on TikTok and on YouTube Live currently. But it's just like, I posed that question. What would have happened to you if you were to have a third of your finances stripped? What if you had a third of your finances just taken away? Like how would that work for you? It was just like, it's funny because we've had this whole issue with the whole healthcare incident with our guy Luigi. Good morning, Annette. And it's just like people don't understand that. It's just like there's health issues across the board. Now, you have people dealing with insurance where it's difficult for people to get insurance. Veterans have already a hard time trying to get disability benefits. Most people, and that's something that needs to get put out there, that a lot of civilians don't understand that. A lot of civilians think that it's just like, oh, veterans get hurt and they just go and it's just like, hey, you're just going to get money. No, that shit doesn't work like that. It's a whole entire process that delays veterans. It's like if you actually sit down and talk to veterans, you understand that a lot of these veterans, it takes what? Years to get a disability rating? because they have to fight through the system, all the red tape, all the paperwork. And it's the same thing as you in the regular healthcare system getting denied for something you've been paying into. So it's the same thing that it's happening with veterans. We paid into the system. We served this country. We took care of this country. We fought for this country. We made sacrifices for our family, for ourselves, and people don't realize that. And it's just like, now on the back end, it's just like, we're not going to give back to you. And that's kind of like a slap in the face for that. But that's the thing, it's just like it comes on both ends. So it's basically the civilian side is dealing with it. The veteran side is dealing with it. It goes on both ways. It's just a different entity that runs it through the VA, because the VA is one of the biggest, basically the biggest coverage that there is when it comes to medical services, because it's supposed to support 19 million veterans, because that's how many veterans we currently have alive. There's only about 6 million that actually use the healthcare and 8 million that are basically getting benefits. So you still got 11 million veterans that don't have anything. They haven't applied for anything. They haven't done anything with it. So that's something people need to realize also. And then the thing is it's going into, let's say, the PACT Act. Somebody mentioned the PACT Act. Now, the PACT Act was basically created to assist veterans that have been coming up with issues that they have realized arose because of their time in service. Most of it being, burn pits, toxic exposure, radiation exposure. Even if you were in like Camp Lejeune, if you were stationed in Lejeune with the Marines, the water. And there's not only that place, because there's multiple other locations which have water issues where veterans are not getting good water, or there's water shit. Isn't Flint, Michigan still like not having good water? And it's just like, bro, we the greatest country in the world and people are having problems with it. And the thing is and that's the thing, and that's a good thing is to mention that, is that why is it that us as veterans can't come together? That's the question I think I want to pose, and I think I want to talk about, and I want to have answers for. Why is it that us as veterans can't come together? Because all it is bickering amongst each other for stupidest of reasons. And the thing is, it's the same thing that happens on the civilian side. Instead of us uniting and coming together to talk about these issues and putting them together so that we can actually build something that actually helps everybody, everybody is just talking shit about this, talking shit about that. Oh, I dislike this, I dislike that. Oh, you're a pogue, or oh, you're infantry. Oh, you're a crayon eater, or, you know, all the jokes and all the stuff is funny at times, but at the same time, it's all just still separating us because of the fact that we are not assisting each other in building stuff to help each other. Benefits may be cut. If we just sit there and not saying against anything, people don't understand that. Most of the time, what people don't understand on the civilian side and on the veteran side is that coming together is what causes change. Anything in this country that has come to change is because people united. Now, the powers that be obviously don't want that. But at the same time, that's the only way we're going to actually have positive change for people. Because when it came to anything that's happened in this country that's changed, is because what? A whole bunch of people got together and decided to say, you know what? Either we had enough, or this is something we need to change, or you know what? I'm just tired of this shit. And it's just like, people don't understand that. But it's just like, in order to do that, we need to come together and find resolutions. Not everybody has the same issues. But at the same time, if we can't have the conversation to get people together to speak on these issues, we ain't going nowhere. It's like, yeah, veterans align with their political parties, which is the stupidest thing. Because look, it's funny. It's funny when people mention that most veterans like to vote for their party. I was just like, you voted for this shit then. So you voted for your shit to be cut. You voted for your benefits to be cut because you voted Republican. So then it's the question of, oh, well, I didn't vote for that. I was just like, well, you voted for somebody that didn't do anything for veterans, that always talked down to veterans, always had an issue. Because the thing is what I tell, and like I said, I don't like doing these workshops as a political thing, but at the same time, you have to put it out there, because the thing is y'all stupid. And I'm gonna say it plain out and simple. Y'all stupid. A lot of y'all veterans voted for a person that talks shit on the thing. Now, what a lot of Republicans can't tell me is why is it that for a person that is so for the military, so for veterans, would they even allow this Department of Government Efficiency to even mention the fact of like, hey, you know what? We're going to cut benefits. Why is that? Why can't a Republican ever give me an answer to that? Why is it a person that is so for veterans benefits, so for veterans and all this nonsense is allowing the talk of having veterans benefits get taken away? Because that's the first thing. If I'm so for veterans and I'm so for the military, the first thing I'm gonna say when somebody says, "Hey, we should cut veteran benefits," first thing should be, "Hey, bro, that's off the topic." And I said this last week too. It's the same thing. But the thing is most people don't pay attention to it because the thing is it's just like, oh, it's just you're just listening to the media. No, this is stuff that even senators, Representative DeLucy, I believe his name, Representative DeLucy from the state of Pennsylvania, has already spoken on the committee floor and in Congress, basically saying, hey, I am a Republican, but at the same time, I use the VA, I use VA care, and if you're going to try to cut the funding for that, I'm going to fight you, even though you're part of my party. So the thing is like you have a Republican representative that is already speaking and saying, hey, I am going to go against my own party because I am an actual veteran and I'm going to have my benefits taken away that I actually use. Now, he's not the only veteran. There's veterans all on the veteran committees and stuff like that. I can rally off all the names of everybody that's in those committees because I have that, and I'm gonna break it down for you so that everybody knows who they are. Because the thing is that's the other problem. It's just like we don't know who to talk to, we don't know who to reach out to. Most people have never thought, let me ask my congressman or let me ask my representative, hey, what you doing about this? Like the Major Richard Starr Act. Most people don't know what the Major Richard Starr Act is. It's basically to allow veterans, because right now, if the only way for you to get medical retirement and disability retirement is if you did over 20 years. What the Major Richard Starr Act is trying to do is like, hey, if you got military retired and you got VA, you should be able to receive both concurrently with no issues. That's basically a proposed bill that's on there. Has anybody talked about it? No. Has it been mentioned? No. Do most veterans even pay attention to anything that has to do with changes? No. Most veterans just take care of it, just like, hey, man, I got my check on the first. That's it. Most veterans don't know all these other things. Benefits being cut. Hold on, what is that? Benefits being cut or by doing public work, cleaning the community, for example, looking for disabled with a harm elderly are going to be looked after by people. I'm not understanding, Gareth, what you mean by that, by the statement. Because the thing is like, look, you got to look at it like this. All these things are going to happen, right? And what are we going to do about it? What are you going to say? Who are you going to call? Because this is the breakdown. I'm going to tell you the breakdown right now of. So this is the House Committee veterans. So in the House Committee, you have representative from American Samoa. You have 2 in Arizona. You have 1. You have, what's that? 3 in California. You have 2 in Florida. You have 3 in Illinois, 1 in Indiana, 1 in Iowa, 1 in Kentucky, 1 in Michigan, 1 in Montana, 1 in New Hampshire, 1 in North Carolina, 1 in Ohio, 1 in Pennsylvania, 1 in South Carolina, 2 in Texas, 1 in Virginia, and 1 in Wisconsin. That's your House of Representatives. Oh, just like you work for a cleaner community, you shouldn't get your benefits cut because of that. That's what the city's for. That's what your government is for. They should have a street sweep cleaning thing. So what is being done to stop from demolishing the Department of Veteran Affairs? The thing is they're not trying to look. This is what we need to understand. That this administration is not they're talking about getting rid of it, but they know damn well this is not going to end well if they decide to say, hey, we're going to get rid of the whole Department of Veteran Affairs. That's not going to happen. I can assure you that. That is not going to happen. The last thing you want to do is rile up every single veteran that's alive. That's 19 million of us. You don't want to rile up 19 million people by doing that. The thing is it's easy. Look, it's easier for me to make cuts. Like, let's say you have anything. It's easier for me to have cuts or bring change to people when you're so divided. Because like I said, for most Republicans, the first thing that was told to them by anybody is just like, oh, they're going to take your guns or your weapons. Sorry, TikTok, don't give a shit. But that's the first thing that always gets mentioned. That has been a talking point for who knows how many decades now. Even the Vietnam era veterans that I know be tuning in can attest to, oh, we're going to take your weapons being a talking point for who knows how long. It's been 30 something plus years and nothing has happened. So basically, now you take that into effect. Now, it's yes, the Democrats were the ones that instituted the PACT Act. So a lot of these veterans right now that were hurting, had cancer, had all these issues from toxic and chemical inhalation and all that stuff, or dealing with chemicals or radiation or dealing with burn pits or literally stirring shit and inhaling that. All that stuff was created to what? Benefit veterans. So how is it that this administration was basically trying to not help veterans when they created a program to ensure that all these past veterans that went through all these issues, went through all these wars, went through all this medication, all this stuff that they were paying out of pocket because it wasn't being covered is not being covered. But now let's go and reverse that. Because the thing is what they're mentioning is a cut to the healthcare system because they want to privatize it. Now, what I don't understand is what most people don't understand when it comes to privatizing of anything, it gets more expensive. Because I tell this to veterans, if you are whatever rank you made it to in the military, whatever you did in the military, I appreciate what you did. You got paid at what you did. You got your salary job at what you did. You worked however many hours a week and you still got paid the same. Now, remember those times and those buddies of yours that decided to get out, and when they got out, they went and did contracting overseas, making six figures in like 6 months? That was contracting. They could have stayed in the military, but they chose not to because they can make more money contracting. So look at the pay difference there. Now, let's say we do that with the VA. Let's say we start contracting the VA. The biggest issue that veterans like to complain about the VA is the fact that, oh, I don't have a doctor, they don't have any availability, or they can't see me. What people fail to understand is like, how many hospitals do you have that are right by near you? And it's just like sometimes it's like questioning, you have to get into the brain of veterans and start making them think analytically, not just what you're being told. Start actually thinking for yourself of what pertains to this. Because the thing is you want to talk about needing doctors, right? So you need these doctors. How many of y'all have all these resources actually in your community? Some of y'all don't have some of the stuff you're asking for that's within or in your community. So you're asking basically for a contract to pay somebody out to do it. Then you want to complain that the VA is wasting too much money. So which one is it? You can't have it both ways. You can't say, oh, I want this doctor to take care of me, but at the same time, we don't got the money for it. How are you going to have that work? The U.S. doesn't pump out doctors. Well, they pump out veterans, though. We keep on pumping out veterans like it's clockwork. Either some people retiring, some people getting medically retired, some people just doing their contract and getting out. That's happening continuously. We ain't producing the same amount of doctors. We don't have the same amount of people that join the military go into the medical field. So we already losing on that. So what do you have to do? So now to get a specialist, you got to pay more. So if y'all look, basically the VA was under, what was it? I think it was at first when they first calculated, the VA was under $12 billion. Then they somehow audited themselves, which I always love auditing myself because, I never find anything wrong. But now it's just like, oh, we overestimated some things and we're only $6 billion under for the next year. Mind you, this isn't counting all of these veterans that have begun coming out of the Afghanistan and Iraq issues. So we haven't even accounted for that. Lena says cruise for president or at least Congress, something. I'm working on it. I need to work my way up. But I need assistance. I need assistance from veterans to get there. It was just like, we need to get veterans that want to speak out on these things and want to talk about these things. So like I said, that was the list. I gave y'all the list already of the House of Representatives. I have the senators too. One of them is in my state. And I've already reached out to him. So different issue, but I've already reached out because the thing is you got to make sure that you're talking to these people. But the thing is all this goes and happens and nobody lays mention to it. It was just like the medical services. We don't have enough doctors in this country. It was just like, look at how much, like for veterans, I want you to ask somebody that has no military affiliation how long sometimes their appointments can be just to get their assistance. Just to see how backed up doctors really are. And then I want you to start thinking about when the VA told you, shit, your appointment is in 4 months. When a civilian might be waiting the same amount of time. So what is the difference between regular care and VA care if you wait in the same amount? You want to say that the VA ain't shit for it, but it's the same thing on the civilian side. So it's clearly not that the VA sucks. It's a whole medical issue that we're overlooking here. But if we're going to cut a third of the budget, it was just like, because the funny thing is, it's just like, let's privatize it, right? Let's cut funding. But then we want community care. You can't have it both ways. We got to pay people. As you can see, people are getting tired of not getting paid. People are having issues with not getting paid now. It's not even like we don't want to do this anymore. It's just like, bro, I'm not getting paid to do any of this. I'm not earning anything from this. I'm working my ass off and I'm not getting anything back. Now, what are you telling these future military entries, like the new trainees that are coming in? It was just like, hey, bro, you gonna go through some stuff, but on the back end, you on your own. Ain't nobody gonna want to join. If you're doing this to the people that served between these two long-ass wars, which is Afghanistan and Iraq, and you mean to tell me when all this influx is going to come in, because you got to remember, 9/11 happened in 2001. Some people didn't join right after. Some people did join right after. That's only 23 years. Some of these people are in sergeant major positions or master sergeant positions, or they're officers, probably close to colonels or something like that, and they joined at that time. So if they joined at that time, they went through those deployments, they went through all that, and then it's just like, hey, bro, thank you for your service. It's just like, it's funny to me because people don't understand that. People don't understand that it's just like, it's a process. Now, the thing is that leads to after the thing. But now let's talk about before we get to that point. Because the thing is veterans are still claiming disability claims. Veterans still don't know what they're supposed to do. Veterans don't know how to file a disability claim correctly. People are getting denied. People don't know how to go through a appeal. People don't know how to file to correctly appeal. People don't know what information they were missing, what information they need to get, and stuff like that. And then that's the thing, is just like, damn, what a coincidence. Same thing happens with medical care in the civilian world. The thing is like, hey, like I said, it's easy to divide us. Oh, you're a civilian. You're a civilian. You're not military. You're not military. You don't understand. I understand what it is to not get a fucking doctor. See, look, Annette Baker just basically stated, I live in Arizona. It's a messed up state. Currently, I have to wait a year to see a specialist. She just turned in two specialists because they were falsifying documentation. It was just like the shit is the system is rigged and it's not in our favor. And people don't understand that. It was just like, you're a veteran. The system isn't there entirely to help. Like, some of the system is there to help. Don't get me wrong. Some of the system is there to help. But at the same time, all of it ain't there. The doctors ain't there. The information ain't there. All this stuff is not prepared for you to be successful at all times. And people need to understand that. It was just like, if you're a vet, why aren't you being taken care of? I was just like, it's crazy because the thing is the benefits are there, but the thing is who's making sure that you are seeing these benefits? When you have the thing is when you have, it's not even like, it's hard to get into because the thing is you have some veterans that be like, oh, they help me more because of this, they help me more for that. It's like, no, it's a fucking job, y'all. It's the same way when you were in the military, and veterans don't understand that. It was just like, not everybody enjoyed their time in. Some of them had really bad times. Some of them had good times. But it's like veterans sometimes forget. It was just like, I came from this organization. I was just like, how many of y'all got great care when y'all went to the doctor in the military? And then y'all just expected the VA to just fucking pick it up? Like, let's be realistic here. How many of y'all actually got great care while in service? So shit, there's probably active duty right now that are going to the look. One thing I realized with my fucking medical records when I served was, hey, I went through my shit. One of the reasons one of my issues got denied the first time around was because the PA decided not to put what the fucking injury actually was. So I got hurt, sprained my ankle. Shit was black, fucked up my ankle. That shit has not been the same since. And they just decided to put running. Not that I injured it running, it was just running. Not that I injured it in the morning formation, running and doing some dumb shit that the Army wanted me to do. No, it was just running. So not literally stating that, oh, it happened in service. It was just basically, oh, it happened. And then I looked at my records and I was just like, I can see why my shit got denied now. Because nowhere did that PA say that, oh, you got hurt while doing military training. They left that part out. They just put service member was running. And I was just like, this mother. And a lot of people don't pay attention to that. That's why I like to tell active duty personnel, if you are active duty right now, when you go to sick call or you go to the doctor, look at your damn records. A lot of veterans don't go to the doctor. A lot of veterans don't pay enough attention to their records. Your records is what gets you your VA disability benefits. There's other programs that have nothing to do with the disability payments. But if you want to be compensated because you got hurt within the military, you have to pay attention to your records. Because the thing is whatever that VPA puts on there, that's what they're reading. So if you said, if you're hurting because your back hurt or you got a bulging disc or your back is this, or whatever the case may be, if they just put it as back pain, what do you expect? What do you expect? Now you a VA rater that's picking this shit up and it's just like, my man got back pain. That shit don't specify that you had a bulging disc. That shit don't specify that you had a dislocated disc or whatever the case may be. So it's just like, you need to stay on these people. And that's the problem that we have in the military service. Most times just think it's just like whatever the PA says or what. Yeah, back strain. You had a back strain. No, bro, my disc was popping the fuck out. It took MRIs and X-rays for them to see, oh shit, you do. Oh, then it became you have a dislocated disc. Before that, back pain, back strain. There was no, you had dislocated disc. There was no, oh, you have degenerative disc disease and your shit has progressively gotten worse. See, look, somebody just said I got 90% after 20 years. Why the fuck is anybody waiting 20 years to get something done? Why? Why is anybody waiting more than a year and a half to get their information done? It was just like, you have the records. The thing is it's just like, oh, he said it's my fault too. It happens. Don't get me wrong. Some veterans decide to claim right away. Some don't. Understand that. The thing is that that's where we need to change and talk to other veterans about it. We need to talk about active duty like, hey, I don't give a shit if you don't feel well. Go to the doctor, get it notated. Have those medical records. Keep your medical records. Another thing, this is one important thing for active duty. If you're doing the benefits delivery by discharge program, the BDD, when you are applying for this, try to get all of your medical stuff, all your appointments and all that stuff done prior to requesting your records. Prior to requesting your records, because these people are going to take like a month to try to get all your shit together. Mind you, if you have appointments within that time period, that shit is not going to be visible. I had to take a disc, put it on my computer, save it, to then add onto my medical records when I made my claim. Because the thing is the information was not there because I did the appointment while I was going through the process. So any appointments that you are doing within your ETS time, you need to make sure that you either re-request your documents right before you get out or find a way of doing it, because otherwise that is not going to populate in there and you can have great information in there that you are not able to submit to the VA for them to view. So all time endure. Because the thing is it's just like I said, I think outside the box and I start paying attention to things that most people don't. And that's what, when in active duty, if you notice, I could tell any active duty person, and I could probably tell y'all vets that are tuning in, when y'all went to sick call or decided to go to the doctor, notice how you were taken care of more when you were about to PCS or ETS. Just take a mental, just go back in time and look at how a PA did more stuff for you when you were about to leave that duty station. While you were in the duty station, it was just quick fixes. They didn't want to offer x-rays. They didn't want to offer MRIs. They didn't want to offer any of the other studies. Once you were getting close to your time to PCSing and leaving, all of a sudden we'll schedule you for an x-ray. We'll schedule you for an MRI. We'll schedule you for this. Because you know what people don't understand is that while in service, what they are trying to do is we need you fit to fight now. When you leaving us, we don't give a fuck how fit to fight you are. You leaving us. You are not our issue. We need to make sure that while you're in this unit, you are fit to fight. When you're leaving, that becomes their problem, not our problem anymore. But most people don't realize that. So like I said, just think back on that and look at it that way and just be like, you know what? Because I got my MRIs and my x-rays when I was about to PCS. I got my sleep study done while in service 2 months prior to me PCSing. And I was just like, holy shit. I was just like, now that I'm leaving Hawaii, now they schedule me for the sleep study. Mind you, I've been talking about having lack of sleep, being tired, not being able to sleep. They sent me to, behavioral health to try to see if I need like the sleep coach behavioral health. Like, try this. You heard of this app? Well, this app helps you do this and do that. Oh, or no, the best one for me was like, you know what? Have you tried going to sleep later and waking up earlier? Or have you tried waking up earlier and going to sleep later? And I was just like, bro, y'all got me fucked up. Like, y'all really think this is the best advice you're gonna give me? That's how I'm gonna fit. Well, y'all didn't want to test me for sleep apnea. Y'all just thought I couldn't go to sleep or something like that. It was just like, oh, well, this app will help. The fuck it did. I'm still waking up in the middle of the night. My wife thinks I'm dying in the middle of my sleep. It was just like, this is still going, but y'all decided to give me a study when I was leaving and not the 3 years I was actually there, where I had gone and been seen for all of this. That's documentation. But at the same time, veterans is just like, hey, if you deployed or not, it don't matter. If your shit isn't in your records, it don't matter. Most of the shit happens to people while deployed. And then I heard one good thing here where this is one thing that is just like, for those that are high up on the deployment and all this stuff, this is one thing I found interesting. A lot of people deal with PTSD. The issue with the PTSD is that people just think that it's caused by combat time. And what people fail to realize is that when you go to combat or you get deployed, you know what you're getting into. You know you might see some shit. You're not mentally prepared entirely, but you have the thought process of, hey, shit might happen. The problem with PTSD, and a lot of people have it, is that it happens to them where they thought they were safe. They thought they were okay. They didn't think a situation like that would happen. And that's where that trauma sticks in, because it's like, yo, I was supposed to be safe in garrison and all hell broke loose. That's more traumatic when you don't expect it and you don't see it that way than somebody having it. No, I'm not going to say it's more traumatic. I'm going to say it's still traumatic. But the thing is some people don't realize that it's like, hey, when you're in a position where you've seen something, it don't matter if you were deployed or not. There's things I saw I didn't want to fucking see, and I was in garrison. And those have stuck with me since shit. That has stuck with me. And I'll say that. But it's just those instances, it's just like most people don't have it. Timothy asks, good afternoon and thanks for all that you do on behalf of veterans. Will the VA rater use the SMC PDF calculator when adjudicating your claim to determine what level of SMC you should be granted? So, Timothy, when it comes to SMC, they are going off of the criteria that fits the SMC. Each SMC has its own criteria. I don't think it's a calculator per se, but it's eligibility requirements. Because the thing is for some, it's just like, if you have this disability. See, look, that is true from the physical assaults and training. It is what it is. But the thing is, so when it comes to the SMC, it's your eligibility and your criteria for each SMC level. Each SMC level is different. It was like, if you notice, they all look the same. When you look at the eligibility criteria, it's like loss of this, loss of that, loss of this, loss of that. Some is loss of this, some is not. Some of them pertain to, hey, if you have one disability that's 100% and you have another 100%, it might get you to SMCS. But at the same time, it's depending on what you have. Everything is dependent on what you have and what your claims are. So I guess I do understand when you mean a calculator, but the thing is they're not gonna just base it off of that, because you still have to go through that C&P exam to examine what it is, what happened to you, how does it affect you, are you bedridden, do you need assistance with putting on your clothes, do you need assistance with eating, stuff like that. So it's just like, yes, the percentages help, but you still have to go through the criteria in the C&P exam and the examinations to validate that it is that problem. So the numbers, yes, it's there, but it's also a thing. So it's a twofold thing. Don't think it's just like, oh, because I fit these numbers, I'm gonna automatically get it. You should know better than that already. It's the VA. So that's what it is. If you're going through one thing and you have the requirements, you have to meet all the requirements for everything. The same thing with aid and attendance. You have to have, or housebound, you have to have the requirements. You have to have that documentation that you have a doctor seeing you, or you have a nurse, or you have your family member that aids and attends you and stuff like that. You have to have that documented and shown. So that helps. And back to like I was saying, Shana, like the thing is most of the time that PTSD is from stuff that you thought you were gonna be safe. And I saw this from another veteran program thing, but they charge for their shit. I'm not charging for anything. I'm just giving you free advice. It says online consulting, and this is for the people on TikTok. I'm on YouTube. Check it out. I have my workshops there. I do this for free. If I make money, it's because you guys decide to donate, which I appreciate, not needed, and y'all watch my videos. That's how I make money. That's it. I'm not gonna charge you a fee, but at the same time, I'm not gonna do the shit for you. This is me educating you on how to take care of yourself. I'm not gonna do any of the paperwork. I'm not doing it. It's just like I had to do the same thing myself to get to 100% PNT. I had to do this research. The only issue I knew is that I had to learn most of this on my own. What I learned is if I teach other veterans how to do this, another veteran can teach another veteran how to do the same thing. And that negates and wastes time of veterans when they have to wait years and years and years to get shit done because they don't know what to do, how to do it. I was just like, I'm going to show you every step. I'm going to lead you to the water, but you the one that's going to have to find a cup, scoop that thing up. If you want to make it tea, find your tea, put it in there and drink it. That's what I'm doing. I'm not doing anything hands-on for you. Have you heard of REE Medical? Yannette, if you can spell out what REE is, it's just like, look, I say this on my lives. Please, even if it takes a couple of messages, spell it out. Spell out what you're trying to tell me. There's too many damn acronyms when it comes to anything dealing with the VA. The VA will acronym the shit out of everything. And it's just like, bro, I don't know. I think I know what you're talking about, but I don't know specifically because everything is there. And then some people have the acronyms in a certain way and they put it in different words. So if you are 80% PNT, so basically that means you are TDIU at 80%. So let me see. Let's bring this up. If I could do this, see if it still works. It used to work. Is it highlighting it? There you go. So the question is if you are 80% PNT, can you raise it to 100%? Yes, because you are 80% PNT because of TDIU. So when TDIU happens, that's how you got that information and that's how you got that rating. You got to the employability. Now it's, do you have other factors that will get you to just 100% PNT, which means you have to go through the rating process. You have to file claims. You have to have evidence and you have to have documentation in order to get you to that 100%. Otherwise, it's not going to be there. That's the biggest thing that you have to realize. You have to get there by having diagnosis, nexus letters if you're trying to get something service connected, or you can try to file for increases in what you have to try to get you there. And that's how you would go about that. Medical offers a guided path to medical evidence. I have not heard of REE Medical offers a guide. Did she put the, oh, and thank you for the Fest crown. I appreciate that. Because the thing is you got to remember, when it comes to medical evidence, it's hard to get medical evidence if you don't know what you're looking for. Like I said, this is the biggest thing, and this is what I'm gonna show y'all. This is a cheat sheet. If y'all don't know, Code of Federal Regulations, Title 38. Yes, and I have a video on that on VA Math too. I need to put links to all this stuff. I don't think I have it. I have a video on my page that basically explaining VA Math. Everything is VA Math. The Title 38, the Code of Federal Regulations, is what helps you with VA Math. Because the thing is it'll show you at the beginning of it. It basically highlights how you get your combined rating, but at the same time, it's identifying what you can file for an increase, because that's what a lot of veterans fail to do is file for increases. Veterans love to let's tie this in, or let's make this. It was just like, first, hey, why don't you try to file for your increases first? Because the thing is you don't have to provide medical documentation for that. It's already service connected. And that's where a lot of veterans fail. It's just like, you have the ability to up your claim doing that. Medical evidence is hard to get if you don't have a doctor doing it or stuff like that. There's different programs and different stuff, but at the same time, it's just like, you still have to have a diagnosis. You have to have documentation for it. You need buddy statements. You need personal statements. You need those statements that help address and paint the picture for the VA. Remember, a lot of these people are not medical professionals. The VA raters are not medical professionals, and a lot of them are not veterans. So you're trying to tell somebody that's never dealt with the military what your issues are, and they're going to go off of the 21-1, which is what explains how they do their ratings and stuff like that. Excuse me. Man, I think my dog getting me sick. But that's something that they go off of, but they don't know anything. So they literally go off of the guidelines. So if you're painting the picture for them, it helps. But it's just getting that percentage. You can get there. The thing is first you have to sit down, go through this CFR. Go through this. Check what it is, whatever the ailment is. Table of contents, and you check. Whatever your issue is, you find it. Find your diagnostic code if you have that already. Find what it is that you have and see where you can get an increase from. That is the first thing you should do. That's my advice. Because the thing is this is something you don't have to fight for. This is something you already have in your record. The VA is not going to be like, oh, I need a nexus letter, or no, it's already service connected. So now it's just like, hey, have any of my issues gotten worse? I want to file an increase for this. Remember, but this is something that goes into it. When you're looking at these things, remember, you may get reevaluated for other things also. The thing is if nothing has gotten better and shit just keeps getting worse, you shouldn't worry about losing your VA rating. Yes, they're going to look into everything, but the thing is they have to look into stuff in a way that, hey, are you getting better? Is it notified? Because remember, it's a process to get a rating reduced also. It is not a, oh, you filed for a disability claim, we just automatically going to drop your rating. It doesn't work that way. And that's what I think some veterans don't understand also. It's a process for a rating to be reduced. You will get notified that your rating will be reduced. You have 30 days, within 30 days to say, hey, you want to go to an appeals court or whatever to get that done. Then from there, you also have 60 days from being notified to provide any evidence or anything that's changed showing that them trying to reduce you is wrong. So you still go through a process to get a rating reduced. It's not you file for an increase, all of a sudden, oh shit, now you're down to 10%. No, it doesn't work like that. It's just like, that's why it's just like people need to understand. If you have something service connected, see what you can get up first. Then from there, look at secondaries. Then from there, that's when you try adding any other shit. Because if you have something service connected, you're already in the system. Your disability is already in the system. There's no coming up with new. You don't need extra evidence or anything. You're already in the system for that service connected issue. What can you increase from there? Then from that you have service connected, hey, now you can go to secondaries, which secondaries can lead you to, hey, I developed this issue because of this service connected issue. I recently received my 100% total permanent, but it took me 3 tries. Hey, it happens. It's not always, you don't always get it first try. Most people think it's a one and done, and it's just like, that shit don't work like that. It takes time. Some people get it there, but then it's also the difference of how well you put your claim together, how much documentation you had, how good was your nexus letter, all that stuff. That all pertains to being successful with the VA. It's not I just submit my shit, oh, I got it. No, it's the process. It's the the it's paying attention to detail. Same way when you were in service, you had to make sure that shit was 1/8 and 1/4. It's the same shit. Some veterans just forget that military discipline that they were trying to instill in you. It's the same shit. That 1/8, that 1/4. If it ain't there, your ass got chewed out for it, right? Why ain't you chewing out yourself when it comes to doing your VA claims? You shouldn't need somebody else to be on top of you chewing your ass out to do it. No, do it yourself. Attention to detail. Make sure you're paying attention to every single small little portion and thing that contributes to you being successful. But then at the same time, you can come here, ask questions, and I'm going to tell you what it should look like so that you are more successful. Because the thing is if you just winging it, you're setting yourself up for failure. See, look, somebody just said, I filed on my own the first time, got 100% PNT, helped his brother and 7 other people get there. That's all I've done. I still have people that are serving that are about to get out and be like, hey, Cruz, I seen what you do, man. I was just trying to see if you can assist me and stuff like that. If it's somebody that I served with, I'll give you one-on-one counseling. If it's people that are just like on here, I did one, and that person is in here, and that's Annette. That's the only person I have actually done a one-on-one. That's the only person. Besides that, it's just like, look, I have to do this in a legal manner where there's documentation and stuff like that. But at the same time, I'm not providing you any of the documentation. I'm not giving you a Nexus letter. I'm not doing that. I am giving you insight into how you can benefit yourself by what you need to do, what you need to look at, what you should provide, what you could provide, and taking a different view and angle to benefit yourself. But like I said, this is something that most people don't look at, but people just go about it the wrong way because they don't know how to go about it the right way. Can you talk about dental qualification? What specifically in dental qualification? Dimples? That's his name. Well, like the names I'll be finding on TikTok and on YouTube sometimes. It's just like people don't use their names, which I understand, but damn. What's needed for dental qualification? Here we go. Hold on. Oh shit! I was clicking on the wrong one. Dental and oral conditions. This is the schedule of ratings for it. First, you got to know what you can actually claim, which is all of this. This all falls under the schedule of ratings for dental and oral. Oh, you will if you go on my YouTube, it's a lot easier for you to view it. The link is in the bio. You can see what I'm showing you, and I'll show you what the CFR and all that stuff has that, so you can see it. You can visualize what I'm telling you because I forget on TikTok y'all can't see it. If you go on the TikTok, link is on my bio on the top. YouTube, you click on there, you'll see that I'm live, and I'll be able to show you, and you can see it from there. It's easier this way. I've been trying to incorporate TikTok to be able to see the same thing, but for some reason, TikTok app makes it crazy. But yeah, so if it comes to dental and oral conditions, you need to know what you can claim. And this is there. The other document, which I wanted to make sure to highlight to y'all, was where's it at? Gotta open it up. Okay. This is the other one. Let's see if it actually populates. Can you see that? Doesn't want to show for some reason. Hold on 1 second. No. It is. Why isn't Adobe showing? The hell? For some reason, it doesn't want to read my Adobe. I'm not entirely sure why that is. Okay, now it should be populating. Now I should be able to show you. There you go. So this is the DBQ. Oh, he signed it into his laptop. But this is something. So to go over what a lot of people don't understand is that now you have the ability to use what is called a DBQ, your disability benefit questionnaire. This is also part of it where it's like, hey, this is kind of like a cheat sheet, I guess you could say, to what it is you can claim and how to go about it. This can actually be done by your medical provider. If you're going to dental and talking about dental, you want to make sure that you are talking to a dentist, talking to your dentist, and providing this document to your dentist so that they can see, hey, what is it that I could be dealing with? Because it gives you that breakdown. It gives you the breakdown of, hey, these are the items that can be claimed. So basically everything on here, let me see. I think I might have to, is that too large? Yeah, so you should be able to see it this way. So basically, this is the dental form. Mind you, this is for everything else. There's also other DBQs. Dental is not the only one. You have cardiovascular, dental, endocrinological, ear, nose, throat, gastrointestinal, genitourinary, like your urinary system, gynecological, hematology, lymphatic, infectious disease, musculoskeletal, neurological, nutrition, ophthalmological, which is eye conditions, psychological, mental, eating disorders, PTSD, respiratory, rheumatological, spina bifida, and then the aid and attendance thing. Those are all DBQs that now you can present to your dentist, your doctor, your specialist, and just be like, hey, I need you to just fill this out for me. Most are going to be hesitant, but it's just like, hey, this is something that I need to fill out in order to assist with my disability claim as a veteran. So you oversee me and you take care of me here. And we spoke about this last week. It's how you approach your doctor also. Giving them the information, seeing what it is you can do. Because the thing is for dental care, it depends. Did you get seen in service for it? Did you have issues? Once you become 100% P&T, you got free dental, and then you could talk to them about it and see what they can and can't do. But these are the things that you can claim under dental and oral. Now, if you take this to your dentist and he's like, oh, okay, you fit this, you got that, you got this, you got that. Then from there, it's just like, oh, okay, now we can actually go and see, and the VA has something to work on that. And then you can you base it off of that. You get your information off of that. So this is basically what you can claim. Because if you can't claim none of the stuff that you're dealing with, if you can't claim any of this stuff that's on here, it's hard to get a claim. Because you got to remember, certain things are not on the Code of Federal Regulations, which is the schedule of ratings. So not everything that you claim is covered by the VA. Not everything is visualized by the VA. Certain things are specific to the VA. Certain things are not. It was just like the same way. It was just like when people have back spasms. There's no real code for back spasms. There's no code for it. It helps with your claim, but does not say, oh, you have back spasms. You are claiming back spasms. Back spasms is how can I put it? You can say back spasms is like a secondary issue to something that you are going on with. So what you need to do is if you have back spasms, you need to identify what it is that's causing that back spasms. And that most likely is what it could be, something that you can claim. But yeah. This is for this one. It was just like, if I could go and I could keep on showing you a bunch. I was just like, let's see, shoulder and arm. Here's another one. Same thing. You go through the system and you just check all the different items. And these are all the DBQs that are there. Like I said, here's the link for that for y'all to have and use. And that's the list of all the DBQs and all the stuff that you can actually use. So if you need that, take that and you can provide that to your doctor, whichever it is, so that your personal doctor can now fill that out. Because now with them filling that out, that gives you the ability to have that. And now you know it's like, oh, okay, now I have this. These are the things I can claim. Now your doctor can identify, you know what? You actually got this too. Or you don't have this, or you do have this. So you can file a claim for this also. Because after me seeing you, I am now diagnosing you with this after researching and visualizing that these are the things that can be interconnected with your disability claim. Because the thing is you got to remember, a personal doctor will be a bit more in depth. Why? Because if you ain't paying them, they going somewhere else. Plain and simple. At the VA, they ain't going nowhere. That's going to be a doctor regardless to whoever many other people see him. That doctor's going to stay. Some of them are great. My VA doctor, amazing. She asks questions. She looks into stuff. She offers like, hey, do you want to do therapy for this? Do you want to do that? Do you want to try this treatment? Do you want to try that? She is amazing. I don't know. And it sucks that not everybody has a VA doctor like that, which is understandable. But I know she's not the only one that's like that in the system. But those are the things that people need to check. You check the disability, the DBQs. You check you check the CFR. You check those things because then that's how you get your ratings. That's how you get your numbers. That's how you identify what it is you're going to do and how. Or it gives you that idea at least of like, hey, this is how I can benefit from this. And that's something that people need to pay attention to. This is something I can benefit from. This is something I can see. This is something I can use. It's something that most people don't pay mind to. And it's just like they don't look at it that way. Because the thing is the bigger problem also is all these other channels that you see on YouTube and all this stuff. It's just like, hey, you want to get to 100%? Well, you can file this, and this, and that'll get you to 100%. It's like, bro, not everybody has this, and this. But the thing is so many people get stuck on the fact that it's just like they go through the process and they listen to these people that they think it's just like, oh, I have this, I could tie this, I could tie that, and I could tie this. And it's just like, bro, I was just like, I would understand why people are hesitant to poke the bear and do that. When you have so many secondaries to secondaries to secondaries, if your first one does get better, there goes all your secondaries. And people don't realize that that's what poking the bear does. It's just like, yeah, you poked one claim that contributes to the rest of your disability. If tinnitus became sleep apnea, PTSD, insomnia, all that shit and all that stuff, and then all of a sudden they check your hearing and your hearing is 10 times better, or you don't have no hearing problems, then that means your tinnitus, your sleep apnea must have gotten better. That means your migraines probably got better. That means your PTSD probably got better because your hearing is not that bad. And it's not, you're flatlining in your ear. It's not that detrimental to you anymore. And that's what people don't understand. First, we got to look at what we have service connected. Make a list of all the shit you got. Look at your ratings letter. Your ratings letter is going to say everything that is service connected, everything that is not service connected, why it's not service connected, and look into it. Because then the thing is now you can use that as part of your evidence. You are looking at it as like, okay, you denied me because this, but you found favorable evidence. I never understood that shit. I'm still trying to figure out how the fuck that one works. I'm still trying to figure that shit out. How it is, I found something favorable, but I'm still denying you. Like, how, Sway? How you figure that? How you gonna tell me that you found something favorable, but it wasn't favorable enough? Hold on, I gotta do. Why TikTok always want to make me notify? Like, bro, I've been talking this whole time. It's just like, I'm glad YouTube don't make me verify that I'm actually talking to you. This shit is so dumb. But it's just like, Your letter will say, "Oh, we found favorable evidence, but we did not." Or just like, bro, what is this favorable evidence? Because then that means you have something in your record showing that you had this issue. The problem was service connecting it, which is something that people don't realize. You can use that as part of your nexus letter. It was like, well, when I did this, you guys found favorable evidence with this, and now my doctor's contributing to the fact and stating that it is likely that I received and had this injury, and this has gotten worse because of my time in service, because I have records in my medical record showing that I had this. But people don't look at it that way. People forget to realize, look, if you telling me you found something favorable, that means there's something in my system. There's something in my records y'all found. Y'all found something in my system that basically says, this is there. I got this. I found this in your record. It doesn't tie to the military, but it's still there. Well, a nexus letter can assist with that, because now y'all yourselves, the VA is basically putting themselves in a bind by telling you, yes, we found something favorable. We just couldn't connect it. Well, now a nexus letter with a medical provider can be like, you know what? This is how it connects. Boom, you just got a rating. Not saying that's going to work every single time, but that's a thought process that is not there. That's not a thought process that a lot of channels try to push to you. They try to tell you, do this, do that, follow the same damn playbook that every other veteran is using and try to get to 100%. Bro, not every veteran has the same thing. I'm in the TDIU process, got my SSID, cervical trauma, all at sea, hoping. I was just like, Andrew, when it comes to that with the TDIU is the easier way to get to 100%, which a lot of people don't understand. The thing is you have to have those ratings have to be there. But at the same time, with the TDIU process, people don't understand that it's just like, yes, you still get the benefits and stuff like that, but you just can't get the pay. You can't make over 15,000, which is at the thing. It's also looking into the fact that it's just like, you know what? Increases, man. Look at your increases. Look at your letters. Look at this. Look at this. Find this. Find this. I'm going to give you a link to the CFR too. Hold on. Top. Here y'all go. Look in that. Oh yeah, you ain't gonna be worried. Like that's the thing. What most veterans also don't understand is just us like 100% PNT helps you a lot. That compensation per month is very helpful. Thing is there's also other programs and stuff you can do that benefit you. It's not only just the disability compensation. There's programs that help you. There's grants out there for veterans. There's businesses. The SBA be doing loans. You still got to go through the process. No property tax or knowing about your property taxes. No paying for your license plates. No paying for hunting and fishing licenses. No shit. Depending on what state you're in, you don't have to pay for school. Texas has it perfectly. If you came out of the state of Texas, you can basically use the VRE program, which is basically your another GI Bill. You can then use the Hazelwood Act, which if you go through there, you basically don't pay for school. And then you still got the GI Bill on top of that, which means that you still get BAH for all that stuff. Like, yeah, I know some people be like, I ain't going back to school. You don't got to go back to school. You can get accreditations. You can learn a craft. It was like, look, man, I always wanted to be a fucking mechanic or some shit. You could go to school, become a mechanic. They're going to pay for it. You want to learn how to use computers and stuff like that. That's something that gets paid for. As long as it's accredited and stuff like that, you still get another check on top of it. You're not working. You can go to school, get a BAH check on top of that, and that's just money you can just earn because of programs that you are afforded. But those are things that people don't realize. Everybody just goes after the stuff because that's what most veterans just talk about. It's just like, shit, most of these channels, that's all they talk about. It's just like, oh, how to get your benefits there, because that's what interests a lot of veterans is just like, hey, how do I get to 100%? How do I get this money? How do I get this money? And there's so much more money out there for you. So many more benefits out there for you. You just don't know and don't ask for them. Most veterans, it's that they don't know. But all this stuff is there. It's making sure you are going about your disability claim. Like I always tell people, if you are filing a disability claim and you can't hand it to a random person and that random person can't tell you what the hell is wrong with you, your claim ain't strong enough. That's it. And I keep on saying that. And now the question is, for some people, it's just like, how do I make it that way? I was just like, I'll teach you. I ain't got no problem teaching. You just got to ask. But the thing is if you don't know, you can't ask. If you're not putting this out to other veterans, they don't know. Does what work if you have unemployability? The VRE? Because you got to remember, with TDIU, it is taxable income. Taxable income. That BAH payment that you get for school is not taxable. That is tax-free. Your school, your GI Bill, tax-free. You will get that monthly pay on top of your disability pay, tax-free. So you're not technically making any money. Now, if you get a job that actually to go to school, yeah, you can go to school. You have your GI Bill, you have the VRE program, and then depending on your state, you have to go to school sometimes. Just ask the school, like, hey, what benefits are offered to veterans? Because each state is different. Some state is like, hey, you don't pay any school tuition. Some have programs that are just like, hey, your books are funded for, or hey, we offer scholarships or grants to certain things. You have to go and ask because each state is different. That's something that I'm working on, but that's going to take forever to do because it's 50 states. And each state has their own little things and their own little stuff that you need to make eligibility for, requirements and stuff like that. But each state is different, but they have that. But you using the VRE program is you having a track. The thing is you have to remember, if you're TDIU, right, and you're going to try to use the veteran readiness and employment, you have to remember that when you're trying to gain employment, it would have to be employment that minimally gets you to all you're making is $15,000. So that's where it's kind of tricky. It's just like, yeah, you can go to school, you can go to GI Bill. The BAH ain't gonna be in there. They're gonna pay for your school, but at the back end of it, when you are trying to get employed, if you can only make $15,000, that's part of the counselor dealing with the counselor with the VRE, because you got to make sure it's just like, hey man, I want to get a job at computer tech or cybersecurity or whatever the case. Ain't no cybersecurity only paying you $15,000 a year. Do not. So that's what it makes it difficult sometimes with the TDIU going that route, is you have to make sure to account for that. Because remember, if you're going to try to get that, but then there's also businesses, you can start your own business, you can start stuff. But like I said, it could be just that you want to learn a trade. And most of those trades are something that you are going to be able to do. But at the same time, you can't go over 15,000 once you get this employment, because that's what it is. But always go and talk to a counselor. Talk to many counselors. See what's available out there. He said, how can you teach me everything? I'm 100% in Texas. I'm already property tax free here. Now what? Check to see what else Texas has to offer, because Texas has the Hazelwood Act. You can use that. If you have kids, you have Chapter 35, which is the DEA benefits, which basically it's if your kids, once they're in school, they provide that. They get a monthly stipend, which is currently at $1,500 a month. If they're going full time, they get a $1,500 tax free paid. Hazelwood Act lets you go to school for free. Like I said, Texas is different. Texas doesn't have property tax. You can't do that. Oh, see, that's the thing. That's why the Hazelwood Act you can't use if you're not from Texas. But that doesn't mean Texas is one of the friendlier vet states. So maybe you didn't come from Texas, but they still have a lot of benefits there. Most of the time, even if you can go to a local VFW, a local American Legion, disabled American veterans thing in Texas, and they'll be able to run down the whole list of, hey, this is everything Texas has to offer for veterans. And that's how you got to go about doing it. Because the thing is there's always the federal level stuff. That's what every veteran gets at 100% P&T. No matter what, you have that. Once you get to the state level, it's dependent on the state because some have property tax deductions. Some of them have it that you can only get the property tax exemption if you're 100% P&T. Others, I forget what state it is. Some states do it by the percentage of how disabled you are. So let's say you 50% disabled, you could take 50% off of your tax assessment in certain states. And it all differs, school-wise, dependent-wise. Even for some states, it's just like, yo, dependents receive these benefits. Yo, kids receive these benefits. So basically, hey, you don't have to pay for school, or school is like at a reduced cost or something like that. You have to inquire about your state because each state is different. I can tell you about the federal level and the top level stuff, but when it comes to those certain specific ones, that shit changes. Everything changes. Some states are good. Some states is like, bro, you must not have any veterans here. It's just like, there's been a couple of states I've looked into and I'm just like, bro, who would want to live here as a vet? It was just like, I would run from this state instead of going towards it. And it's just like, that's how it is across the board. But those are the things that people need to visualize and see. But yeah, it's just like, when it comes to that, you go into school, you get those benefits, you get that check. It's an extra check. If you're using a GI Bill, that's an extra check. That's extra BAH. If you didn't transfer it before while you were in service to your kids, then hey, the one benefit they can get is the DEA, which is the Chapter 35, which is they will get a monthly stipend while they're in school. But they have to apply for that. They have to go to the school and make them aware, like, hey, I am a Chapter 35 DEA dependent, and I would like to use this and file for it. Because the thing is that's the way that the school and the federal government tracks it. Like, oh, this is that. Now imagine, you know how much that changes when you have your kid, like I said, $1,500 a month, depending if you're full time. It's less if you're not, but that's benefits there and everything there. For some, you have to be at 18. But remember also, when you are collecting disability payments, if your kid is enrolled in a school after 18, because remember, the benefits stop at 18. But if your kid is enrolled in a school after 18, remember, your payment goes up while the kid is in school. You get extra disability pay when your kid is in school. Most people don't realize that. Most people, when they get to 18, they forget about that shit. Kid drops off. It's like, no, you have to be in an accredited school, and then you get the higher pay rate for the thing, because it's usually like only $100-something per kid or something, and it goes up a couple. It goes up. Let me see. Let's see if we find this shit. I always hate this thing because it's like I gotta click 18 times to find out what the hell the rates are. I just went through like 15 different things just to try to find out. That's why I just made that video. Check out the video if you want to know how much I get paid this day. But see, compensation rates for 100% disability. So each additional child under 18, 106. Each additional child over age 18 in a qualifying school program, 342. So you're getting an extra $236. So extra $236 because your kid is enrolled in school. And a lot of veterans fail and forget to do that when their actual kid is in school, they forget to notify them like, hey, my kid is in school, man. Because once they hit 18, boom, that shit is done. Because that's why when you look at your benefit letters, it has the date of when they turn 18, basically saying this is when that payment expires. But it goes up to 342 now. By the time your kid is in 18 and actually in school, it'll be higher. But that's what it's at now. That's what you would receive if you're doing that. And that's stuff like people don't understand. Those are things that are there. That's information that's available to you. But yeah, that's the gist of most of it. It's just like, we need to realize that stuff, look at it. But like I said, that's what it is. If y'all got questions, ask. If you know veterans that have questions, send them this way. I was just like, I do this for free. I don't charge you. I'm not going to charge you an upfront fee. Remember, I am not going to do the work for you. I'm not doing that. Because if I am going to do the work for you, then yes, definitely I would start charging people. But I'm not doing the work for you. This is on you. You are your own resource. You are your best resource. You know yourself better than what I know. I know how the system kind of works. I was going through divorce again at that time and I let it fall out. Yeah, it changes. Stuff like that happens. And it was just like different instances, but it's just like I'm not charging you. It was like go to any one of these other channels and they're not giving you this information. That's why I say if you want to donate, you can donate. If you want to subscribe. If you want to watch the videos and share them, that helps me a lot. But I'm not going to charge you. There's a couple of entities that are here on TikTok that I've seen and even on YouTube where it's just like, yeah, we got a flat fee or they got this contract. I was just like, this is, look at all the information I showed you. All the information I presented, free. Every single document I showed you, free. On the internet. You ain't paying for it. Filing a disability claim, that shit is free. You don't got to pay somebody to do that. You can do it yourself. Now, when you know how to do it correctly, you really don't have to pay yourself. But at the back end, now, if you listen to what I was saying and all of a sudden you become 100% PNT, please just let me know. I'm not saying give me, I'm not asking for part of your check. Because I know I helped you get there, but I ain't asking for that. But I would at least like to know that it helped. Because that at least to me means a lot more when I get people that come in and be like, hey man, I appreciate what you do. You helped me get here. Those are the best phone calls I've gotten from my buddies that I've helped them get to 100% PNT. I was just like, ain't nobody sent me no gift cards. Nobody sent me anything. But hey, I know going forward, that person has a better future for them. Their kids are better taken care of. They're more prepared for the struggles that may come in the future. And if I had a part in that, that to me, I'm happy with that. I'm happy with that. Now, can I charge? Would I be able to charge? I'm not accredited, but none of these other entities are either. None of these other entities are accredited people. Most of them is just like, we'll provide you a Nexus letter. Shit. I have a gentleman that comes in on here all the time, and he was telling me that somebody was trying to charge him $1,400 for a Nexus letter. And I was like, what? $1,400. If you are in the position that you are now, you ain't got no $1,400. You ain't got no $1,400 to just spare to pay somebody for a letter that might not even work. Why not go about it the right way and do it yourself? Get your proper documentation, find how you got to do it, and do it that way. I was like, if you do it that way, you'll be better off. It was just like, you know who you are. You know what you deal with. Most of the time, these people are going to tell you the same stuff, and it's just going to go, hey, go through the CFR. The CFR provides you this. This is the information. This is what we're looking at. Or just like, oh, you're going to claim, let's say, mental health disorders. You're claiming PTSD. Well, this is what PTSD falls under. What are your ailments? Do you have documentation? Do you have therapists and stuff like that? But at the same time, most of these things are looking at it as like, hey, most of them are going to tell you the same thing. File for an increase. Can you get an increase first? If you can, you get the increase. You just lessened what you needed to get. Because remember, the whole goal is to get to 95% plus. But at the same time, this is what people need to realize also. Just because you're there doesn't mean that your issues are static. Meaning if they're static, the VA understands that your issues are not going to get better. And that's the part that most people fail to realize. When your conditions are static, those are the ones that basically the VA understands like, yo, there's no way this is getting any better. Okay, we will give them this claim, and we will certify it as, because we know this isn't going to get any better. I have 3 veteran children with rates varying from 80% to just starting the process. So yes, this is very helpful, and I can direct them to you because mom. Chandler, I appreciate that, and I have no problem assisting. Keep in mind, I don't know everything. But the whole purpose of doing this channel and doing the Veteran Awareness Project is that to bring awareness to you. Because the thing is I don't know all the stuff. I seriously don't. I don't. But I'm going to search for it. And I'm going to show you how we do on this page. I'm going to show you where to find it. What you do with the information, I'll let you do the homework. Because that's one thing I was thinking about doing, is maybe do like a 2-day workshop thing, and make it that it's just like that I will charge for, and just put like a complete workshop. But the thing is, it's going to be a 2-day process, 2 separate days. So let's say it'll be like a Tuesday and a Thursday thing. On Tuesday, we're going to go over all the issues and all the stuff we going on. That Wednesday, you got homework to do. Thursday, we're going to talk about the homework, and then we're going to do the Q&A and do it that way. That's what I'm formulating right now. Still a process, got to put all the documentation, all that together. But like I said, this is a process ongoing. The website will be up on the 1st of January. I'm still working on that. That's just going to provide some of the resources that basically are hard to find on va.gov. It'll just be on the website, and you'll be able to click, get information. I'll be doing videos on frequently asked questions, answering like that and stuff like that. And as people do it, I'll just keep on answering and going that way. But yeah, the whole thing is leading you, like I said, leading you to the water. Because if you got kids they're doing this, it's just like they don't get taught. If your kids are still in the military, tell them to go to the doctor. I don't give a shit what it is. I don't give a shit what their command team says. Go to the damn doctor. It don't matter what your damn leadership says. If you hurt, you hurt. Go get a sick call. Go get a thing. Go to behavioral health. Go all that stuff. I don't give a shit what your damn thing does. That's the problem. A lot of people let the military dictate too much. I understand the military dictating the stuff that's within the military. But when it comes to your health, the military shouldn't be dictating that to get you well. If you're not 100%, you're not able to provide 100%. And some people don't have that. Some people don't have that mentality. If you got kids in the military, or you know people that are in the military, or you have somebody's friend of somebody's friend that's in the military, tell them to go to the damn doctor. Because the whole point is to make sure that this next generation is not dealing with the dumb shit we're dealing with as a generation. It's the whole point of improving our generations, is getting the next generation prepared and better for what we're doing. Because the same thing was just like, look, if you went through all these problems getting your disability ratings and you're not assisting going forward, we ain't doing shit for each other. So you're saying that you are trying to increase from 80% with hypertension and tinnitus secondary to sleep apnea, or you trying to put tinnitus secondary and sleep apnea secondary? You got to remember, Gabriel, it was just like, look, you're trying to get increases from what you have as your 80%. What can you increase with that 80%? From all the stuff you have, what there has gotten worse that you can file for an increase first before you start trying to add all this other stuff? Because that's the thing where people, that's what I say, like, let's say you're getting paid at the 80, right? We're going to highlight this because there's one thing. You're getting paid at the 80 mark, or 80 up here, right? That does not mean that you are at 80%. Let me say that again. Just because you are getting paid at a certain percentage does not mean that that is the percentage you are at. You have to specify what your percentage is. You could get on here on the CFR, and you got a whole bunch of other calculators and stuff like that. You have to go and add it up like this. Because the thing is you're getting paid at the 80 rate, but you could be at 75. And 75 to 95, you need another 80% basically. To get to 95, you would need another 80%. But if let's say you were at 84, which is still paying you at the 80 mark, to get to 95, you just need 70%. So it's only a 10% difference, but that 10% difference goes a long way when you file in those increases. Because tinnitus does do a lot of stuff. Tinnitus leads to migraines. Tinnitus leads to possible sleep apnea. Tinnitus leads to a bunch of things, but you have to have the diagnosis for all that stuff. You have to have that connecting factor. There you will need a nexus letter tying that into each other. You have to have that nexus letter that ties like, okay, you do have this. So we do classify you with tinnitus. Now, how does that, I need a better VSO. Unfortunately, not every VSO is great either. But this is where like going through here and educating yourself on those things, because you got to remember, different things connect. What you need to also make sure you're doing is look up studies. It's not only just what these documents contain, it's also studies. Look for studies. Look for studies that contribute from tinnitus to stuff. That's something I want to look into and start researching more, like those connecting studies, because those studies help. But then you have to make sure that those studies connect to your time and service. Like, hey, having tinnitus does contribute and has been shown to cause this. Okay, now that's a secondary. Now that's something that can be put into a nexus letter. Now that's something that you can present to your doctor, which your doctor can now see. It's just like, oh, I didn't even. He said, you're opening my. But that's the thing, is just like, it's looking at it in different ways, because most people just look at it in the way that everybody else sees it. I see it differently. I see it in a way where it's just like, how can I maximize what I'm trying to do to become more efficient? I've always been trying to be more efficient. I don't want to waste time. I don't want to waste people's time. That's the one thing that was just like, my soldiers love me for that. Bro, I'm not about the bullshit. I'm trying to get this done and get the hell up out of here. I'm not trying to stay here till whatever time to get something done. What can I do to make this easier on me? Okay, what does a nexus letter provide? What does it look like? And that's something that I showed people. It's just like, people have these free templates and stuff like that. Cool. Fill it out correctly. Some of these templates are good. I'm just showing you what it needs to have and what your doctor does. But the one thing that people don't tell you is have you provided your doctor with a template of the nexus letter? Because they always say, oh, hey, doc, I need you to write this nexus letter. If your doctor never served in the military, don't know what it is, he don't know what the hell you talking about. He don't know what a nexus letter is. Show him what a nexus letter looks like. Then your doctor is better prepared to write you a stronger nexus letter. Because now he knows, or she knows, what the identifiable information is, what's the statements that the doctor knows they need to make, and do it that way. I see you, coconut. I was just like, aid in attendance for PTSD, you have to be able to show that you do not have anything that is not working for you. You need that assistance and all that stuff. You need all that documented, Q. But that's the thing. Your nexus letter needs to provide that. You need to have that. SNC, thank you for the donut. You have to be able to provide that. You have to show that. You have to show that information in there. That information has to be visible when that VA rater looks at it. Like I said, VA raters are not medical professionals. Some of them ain't even service members. Some of them ain't even veterans. Some of them never worked around. It was just like, hey, brother, VA hiring. Oh, it's computer work. All I'm doing is looking over files and looking. Shit, I'm applying. I get a federal job and I'm getting good pay, decent benefits and stuff like that. Shit. They file for it and they don't got no damn idea what it is. They didn't know about you waking up at 05, being at formation at no, hold on. They don't know about those nights that you woke up at 04 to be at formation by like 0445 to have company formation at 05 to then march over to that brigade or division field at 0530 or 0515 to then take accountability of the battalion at 0545 to then have the beginning of the formation at 06 and then not start the run till 0630. Which one of y'all, any one of y'all had a flashback? Any of y'all just had a quick flashback? I sure as hell did. I just had a quick ass flashback just talking about it, waking up in the damn early morning for the formation of the formation to the formation to get to the formation and then have the actual damn run. That's the thing. It was just like, there's two things I always say. You have to write your claim and have your claim to be able to give it to somebody that doesn't know who you are so that you can get it right. And at the same time is you have to do the heavy lifting to make sure your claim is correct. Because the thing is like I tell people, you can have the shitbag VSO and you can have the high speed VSO. You have to make sure that when you hand that claim or have that information, have what you need, the shitbag and the high speed can still get you where you need to go. That's it. If you hand the shitbag a shit ass thing, he already a shitbag. He ain't gonna really care and go in depth. He just gonna do what, okay, I filed it for you. The high speed is gonna be like, hey man, you need this. I need this from you. This and that. They get paid the same. People get paid on salary. That's just y'all gotta. It was just like, look, if you're getting paid the same amount for extra work, you ain't going as hard, are you? If you know you were supposed to get overtime pay and they just said, nah, we ain't giving you overtime, are you really going to work that much harder? Oh, it's just like people forget that. People forget that. These are people too. It's just like they make mistakes. They overlook stuff. And some just want to check. The same way when you were in the military, you had them shitbags that was just collecting them checks. When you had them seniors that didn't want to fucking get promoted and didn't do anything else and didn't want to hold any responsibility, but they were still holding that position and they were still taking a check and they were contributing to another person not being able to move up because they were a shitbag. Happens everywhere. It's not any different. Thing is sometimes veterans forget that it's just like the same shit that happens in the military happens in the outside world. It's not any different. You do have those people, like the same thing with the CMP exams. You have people in the CMP exams. You have some examiners that will put extra claims into your shit. And then you got CMP examiners that just fucking put, well, you're here for this evaluation. This is what I'm evaluating. I'm not doing anything extra. You came in here for back issues. I'm checking your back. You could have shit with your sciatica. It could be causing other shit. That CMP examiner is just like, well, you came in for your back. I checked the back. You got other CMP examiners that just be like, oh shit. Damn, I didn't realize. Well, you got this here also, right? We can add this here. That's the thing. It's just like you can send links you can send links, put them in your stuff. Don't just send the links. Print that shit as a PDF, save it to your computer, put that on the side, and make a folder. So I tell people, when you file your disability claims, make a folder. Don't go off of just your medical record stuff like that. Don't go off of what you have in your records. Separate it. If you are claiming for tinnitus, everything that has to do with tinnitus, you should have in a folder. You should have one folder, VA disability. Within that folder, tinnitus. Any documentation, anything you have for tinnitus, boom, tinnitus. Then what you end up doing is you put all of those documents together. So now everything that's tinnitus related, whether it's diagnosis, checking the stuff out, and all that there, put it and separate it. Because now you gave that VA rater a whole document that pertains to your one disability claim. Whether it's because the thing is, like I said, people fail to realize they control F. They search within a PDF. A PDF cannot search pictures. If you have a picture of a form, like, hey, this has this. You just took a picture of the shit. The PDF ain't reading that. You can have the most important information on that picture that was provided to you by your medical doctor and stuff like that. When he hits that control F, that picture's just going to skim by. It's not even going to show it up. You can have it that, hey, they misspelled the letter, or the PDF when it search for it, you search for ankle and he mistyped it and put the K before the L or the L before the K, or whatever way he misspelled it, can't find it. We have this week. I got mental health appointment third time. Look, like, that's the thing. Having all that but separating it is a big factor. Because now if you have all that, you have the diagnosis, you have your treatment, you have your plan of action, all that stuff, it's there. And then if you're putting it under that title, so it's like, hey, mental health or PTSD or insomnia or whatever it is. It said, I'm 100% in August, lost a condition. You can file for that. I think, what is that, the 1151, I think? Is for something that was caused because of their mistake. And you can do that. Because then it goes through like litigation and stuff like that. But then you could be looking into back pay, because if they fucked it up in the first place, you might try to do that. But like, I understand. A lot of people just don't want to deal with the VA. They get tired of dealing with the VA. I understand. The shit is overwhelming. Nobody knows about this that gives you most of the answers. Most people go to this fucking site. This shit. Y'all saw how I just showed you, just to try to get to the disability rates. I had to click 4 different fucking times. You know that's what veterans are looking for. Why don't you make it one of these clicks? Top pages, disability rates. You can just add that shit. But no. Makes it difficult. It was just like this. There's so much info in here that it's hard to separate the stuff. Okay, you reported them. Good. That's what we got to do. Report them. Fill out those ICE surveys. Fill out those surveys, those questionnaires. We got to do it. Most veterans, we don't do that shit. I'm at fault with that. I'll be doing that shit too sometimes. I'll be forgetting. But when they send you that stuff, you need to fill it out. Don't just throw it in the trash. If you had a trash CMP examiner, put that shit on there. This person sucked. This person didn't do this. Person didn't do that. Person didn't write this in, or person just was nonchalant and disrespectful. Whatever it is, put that shit on there. Because at the end of the day, remember, if it's being contracted, they're just going to renew that person's contract if he was a piece of shit. No, they don't tell you to keep fighting. Most of the easiest thing they do is just like, hey, you see this form here? If you want, there's a supplemental claim, the higher level review, and this shit. It was just like, you could do that. Most people don't fucking read that page. That shit is the last page. Ain't nobody, by the time you read through your, you know what they should do? They should put that shit as the second page. The appeals process. Not at the back end. Because you know why? I know how much. I don't even know for sure the number, but I know it's probably higher shit. The amount of veterans that look at that damn rating sheet and start reading that shit and it's like, connected, service connected, yes, no, the fuck, no, the fuck. You get so pissed off you don't even make it to the last damn page, and you just want to quit. You're like, man, fuck this shit. It's a fucking appeal. I'm done with this shit. It's just like the amount of people that look at it that way. It's just like, bro, they need to put that at the front. It was like, look, if you have an issue with this, this is how you go about it, or this should be at the beginning of it. Not at the back end when everybody done got pissed off and it was just like, you know what? I'm not reading the rest of this shit. And then you don't do nothing because it's just like, it just says you were not service connected. And most people don't know to appeal, and they don't know that they have within a year to appeal. And most people just leave it at that. It was just like, well. But that's the thing. If you ain't writing a claim, if you ain't writing or answering that survey saying that this person did a shit ass job, we contributing to that shit ass job. We're contributing to having shit ass people work at the VA because you're not saying anything about it. You got so used to being in the military that it was like, you know what? It is what it is. Most veterans know how to take a loss and they were like, you know what? Fuck it. On to the next one. And that's the mentality that we need to change. It was just like, hey, we took this loss, but I'm reporting his ass. I'm doing this part. I'm talking about this. It's just like, if you're not doing that, that's not going to help you. You're not going to contribute to anything to benefit us as veterans going forward. We need to fix the situation. We need to hold people accountable. We're not doing a great job of that in anything dealing with the government. But see, at the same time, this like loops me back all the way back to the beginning, right? How we were talking about possible cuts to benefits, right? It just looping it all the way back. Now, you see all the shit that we've spoken about today, all the shit that we went over, talking about claims, talking about benefits, talking about all this stuff. If we ain't paying attention to it and we ain't getting together as veterans and we're not holding people accountable, we're going to lose out on a lot of shit. We're going to lose out on benefits. We're going to lose out on compensation. We're going to lose out on programs because we are not doing our due diligence as veterans and fighting for our benefits, making sure our veterans are not having their stuff stripped away, making sure our family is taken care of, because that's all there. If we're not holding these doctors that are doing a shit-ass job accountable, and we're not holding these politicians accountable for trying to take our benefits when they never put on the uniform, which that's the crazy one to me. It's just like, you never served and you talking about we're going to take your benefits, but then they don't take cuts to their benefits. Funny, ain't it? I'm not a politician, but I think you're getting paid too much. I think we need to cut some of your benefits. Why is that never a part of the equation? Anybody? Anybody got an answer for that? These people get paid for life too, right? You a public servant. You ain't coming out with PTSD out of Congress. Or maybe you are, but, well, from what you keep hearing from Congress, I wouldn't be surprised if you did, but you ain't having no back pain. You ain't having no ankle pain. You ain't having migraines. I got sent info they want to stop double dipping with disability and retirement. Yeah, because they want to take that away. And that's and the crazy thing is that's what I said. It was just like a lot of people, a lot of Republicans are the ones that voted for this. Republicans voted for this because the Republicans are the ones that are pushing this shit to save money. They're the ones that are pushing this entity. They're the ones that are pushing all this stuff that restricts it. It was just like, why the hell are you trying to take away a person that did their 20 plus years retirement and they can't collect their disability? So you had them serve. So this person served over 20 plus years and you fucked up their body, and now you don't want to compensate them for the body parts you fucked up. But here we are arguing about other shit, right? I was like, that's the part that people don't mention. That's the part that people fail to acknowledge. Oh, let me see something. Some people fail to acknowledge that part, and it's just like that's the spot. That's the part that we need to be talking out loud about. But we not. Because look, the VFW is working on that Major Richard Starr Act. Basically, which what? If you are under 20 years, you can collect both of them. Because you can only collect it right now if you are over 20 years. But if not over 20 years, they don't want to do it. I was just like, if you got medically retired from the military, best believe You got out of the military because the military got you that way. It wasn't a decision you made. The military saw that, bro, you ain't gonna make it. And they decided to get you out. But now they don't want to compensate you for doing that because it's just like, hey, that person could have made it to 20 years and they didn't because they got medically retired. Whose fault is that? Wasn't theirs. It was the military. You the one that got them to that point. But you can't let them, you don't want to let them collect both. And it's just like, Major Richard Star Act was that. The other one I was looking into was, hold on, give me a sec. Let me pull this up. It's on my community thing, because if you haven't realized, I do that every week, Monday through Friday. I also do quizzes and questions. So I have questions every day of the week, basically going over just random VA topics, random VA questions to ask. And then I ask if how many people knew what the Senator Elizabeth Dole 21st Century Veterans Healthcare and Benefits Improvement Act does. And I can tell you most veterans don't even know what the hell that act is. Most veterans don't know that there's acts trying to be improved to address certain things. And like I said, that's the problem we have. A lot of veterans are just finding out this stuff when, oh, the news reports this, the news reports that, instead of it being, hey, you should be aware of what your benefits may happen or what may happen to it. Because the thing is, hey, put it like this. This is the thought process. I'm not, like I said, I don't want to do fear mongering and stuff like that. I want you to start thinking outside the box. Now, if the federal government is saying, hey, we're okay with cutting your benefits, why wouldn't the state do the same? What's stopping the state from doing that? Federal government said, hey, we're going to cut your benefits. What does the state decide to do? The state just said, you know what? That's a pretty damn good idea. We could save a couple $100 million or a couple of millions here, a couple of millions there if we just cut this benefit. What's stopping them there? Because if they're okay with doing it at the federal level, why wouldn't the state follow? Because it's just like, hey, well, if the federal level doesn't want to fund this, we ain't going to fund this. We're going to save money. I'm just saying, I'm not saying that's what's going to happen, but you got to start thinking it's possible. You allow us, you and I and other veterans allowing cuts like this to happen is just going to start a downhill effect. And all it's going to affect is veterans, because it's not going to affect the people at the top. It's just going to affect veterans. Veterans are going to run into these issues. Veterans are going to have these problems. Veterans aren't going to be able to take care of health care. Veterans are going to lose out on their disabilities. Veterans are going to deal with more issues than people can acknowledge or realize. If we just sit on the side, we're not answering, we're not talking, we're not having dialogue with these people that are trying to make these changes that affect us. You filing for that disability claim, if we already have a backlog and people behind and stuff like that, if we are filing for this stuff and we can't get shit done now, what makes you think they're going to be able to do it with the VA having less funds? That means cutting jobs. It was just like people don't look at the ramifications of the stuff. People just want to be like, oh, they just talking about it. No, they're going to propose bills on this stuff. I was just like, that's what you need to talk about. They don't talk about shit. The news don't report none of that. You listen to CNN, NBC, Fox News, ABC, all these different channels, they ain't reporting that shit. They just give you the fluff. All the stuff that happens in Congress. All these paperwork and all these policies happen in Congress. The stuff that one of the people that was in Project 2025 is now the director of policy? Imagine that. The person that is instituting all these changes and all that stuff is now in charge of the policies. But y'all don't want to pay attention to that. Y'all want to be doubtful. Y'all don't want to hold yourselves accountable for what y'all particularly did, which is the problem. but you want to hold somebody else accountable. Same thing with your disability claim. If you ain't doing your due diligence and you ain't doing a good job, you want to blame it on somebody else for your disability claim not being approved. It's your disability claim, not their disability claim. If you're not doing your due diligence, if you're not doing your homework, if you're not doing your research, if you're not getting your documentation straight, if you're not preparing yourself to do what you need to do, that's not on the VA. That's on you. That's entirely on you. That's not on anybody else. That's you failing to provide the information you need, failing to provide the documentation you need, failing to provide your buddy statement, your witness statement, your diagnosis, your nexus letter, your medical study, your medical procedures, your medical history, how it ties into it, how your actual medical record from the military. All that stuff contributes to you being able to provide that to somebody that doesn't know you and get you a damn rating. We got to stop blaming other people. If we're going to blame people, acknowledge where you're at fault also. But at the same time, let's start coming together, y'all. There's too many damn veterans out here that are just contributing to the nonsense. We are ruining things for ourselves because we're not coming together. We're not talking on these subjects and we're not having dialogue. If we cannot have dialogue on how to fix these situations, look into these situations, we're not going to go nowhere. We're not going to fix these situations. These situations are going to continue to get worse and worse because all we're going to do is bicker about each other. There's too much dialogue of where you served at. What was your MOS? Did you deploy? Did you do this? Did you do that? And at the end of the day, all your fucking benefits is going to be taken away. Or whatever it is, every veteran is going to receive the same issue, no matter how many times you deployed, how little you deployed, what your job was, where you served, where your deployment was at, or whatever the case may be. At the end of the day, every veteran is going to lose out if we lose our benefits. They're not going to say, oh, well, you deployed. We're going to give you this. It's not going to happen, y'all. That's why y'all need to stop that bickering and bullshit about it. It was just like, you're a veteran, you're a veteran. You served honorably, you got out honorably, you're a veteran. I don't give a fuck what you did. At the end of the day, we still need these benefits. At the end of the day, we still need health care. At the end of the day, we deserve this compensation. Why? Because we sacrificed. And we sacrificed our body. We sacrificed our blood and tears. We sacrificed our time. We sacrificed and lost people in the process, which doesn't go away. And we deserve to be compensated. We deserve these benefits. We deserve to be taken care of for the job that we volunteered to do, which, yes, we volunteered. But at the end of the day, we did it when others didn't. There's no justification for trying to remove our benefits. I don't care who you are. I don't care what you did. There's no justification for that. Anything that happens that is for veterans is a plus. When we start removing stuff for veterans, we all lose. It's not just those specific ones. If you start adding programs here and there, it benefits us all. Maybe not directly, but at least, hey, if they instituted one program that takes care of this group, that means that, hey, we can keep on working to make it so that the whole group gets it. But when it starts that, hey, we take away a benefit, that's every veteran that gets the benefit taken away. So keep that in mind. And I'm going to end it on that, y'all. Like I said, keep talking to each other, keep working with each other, keep assisting each other. Let's continue to have positive dialogue on how we can make sure our benefits get better and don't get taken away. As always, be good to one another, take care of one another, look out for one another, love one another, and stay marvelous while doing it, y'all. I'm Just Cruz. This has been the Veteran Awareness Project on 15 December, I'll do a little recap. I'm not sure how to recap this whole episode because it was just like all over the place. And that's how most of these are. But it's just like, if y'all got questions, ask them. Send people here. I do this for free. I do this there. If you want to assist, donate to the channel. Do a super chat or super thanks. That's how you can assist the channel. It's not required. If you would like to do it, go ahead. Become a member if you would like to. Subscribe to the channel. Send this out to other veterans so that other veterans can get this information, and it's not a cookie cutter, and it's just directed so that we can assist veterans and have veterans come together. That is the biggest thing we are failing at, is coming together as a team. We served as a team. As veterans, we need to operate as a team. That's it. Assist one another as a team. Be a part of that team that we were a part of before. Those days are long gone. Some of us don't do it. Some of us recently did it. Some of us did it a long time. But at the end of the day, you were still part of a team. We need to continue that and build on it so we can assist each other, work on developing policies, and work on developing stuff that can benefit us as a whole as veterans. That's all I got. I appreciate y'all. Thank y'all. Y'all have a good rest of y'all week. We will be up and running probably again, I would say either Wednesday or Thursday. Looking like those afternoon ones is a higher possibility. And then next week we'll probably do a bunch of them because kids is out of school. These kids don't go to school nowadays. I don't know what the hell's going on. I never had this many days off. But we'll do some more of that. Work on the website. Check out the website. It'll be out on the 1st of January, members, and then you'll be getting a sneak preview of it way before that. And we'll announce it, do that. Take care. Y'all be good. Cruz signing out. Peace. There they are.